Welcome to the Mama Stay Fit podcast, Birth Story Friday. In this episode, Elysia is going to be sharing her birth story where she had a PPROM, which means that her water broke before she was 37 weeks after developing preeclampsia. She had a hospital induction with Pitocin and had an unmedicated birth. Her baby had no complications after he was born, and they transitioned pretty smoothly into the postpartum, although she did have a postpartum hemorrhage. Something to highlight within Elysia's story is that her baby had a 2-vessel cord, so she talks about the different things that they did after they found out that their baby had a 2-vessel cord, and Roxanne's going to take the time to educate you on what that even means. Welcome to the Mama Stay Fit podcast. This is Gina, perinatal fitness trainer and birth doula.
And this is Roxanne, labor and delivery nurse and student midwife.
And this is the Mama Stay Fit podcast, where we empower you on your prenatal fitness, birth, and postpartum return to fitness journey.
Our podcast shares how to move throughout your pregnancy to stay strong and comfortable. Pain is not a requirement of pregnancy. Understand the science of birth and how to approach recovery after birth.
We share our personal experiences as mothers navigating the stage of lives, plus our professional expertise as birth workers and fitness professionals.
Our goal is to help you feel confident as you navigate the perinatal timeframe for an empowering pregnancy, positive birth, and postpartum journey.
We are glad to have you with us on this journey and that you've chosen us to support you. Welcome to the Mama Stay Fit podcast, Birth Story Friday. Today we have Elysia here, who is going to be sharing her birth story with us. So thank you for joining us.
Yeah, thank you guys so much for having me on here.
So let's start with, how did you prepare for pregnancy?
So really, we didn't do any crazy preparation for pregnancy. We did end up trying for a whole year. So towards the end of that year of trying to conceive, I did start kind of watching my diet and just trying to work out more and things like that to maybe prepare my body more. But we didn't do a ton, just kind of kept trying. And eventually, after a whole year, we ended up getting pregnant.
Well, that's pretty exciting. Did you guys have to do any sort of fertility, or it just happened kind of on its own?
No, we didn't have to do anything. It did just eventually happen on its own.
That's awesome. So you took our childbirth education course as a part of your prenatal preparation. How did the course help prepare you for birth?
Yeah, so that was actually really helpful because I didn't really know a ton about birth. I hadn't really experienced that with any of my family or close friends or anything. And so it really helped me understand the process of birth, the purpose of contractions. And that really helped me. I wanted to have an unmedicated birth. And so learning the purpose of contractions really helped me through each one of them when I did have the baby, and really gave me a purpose and really encouraged me. Especially, I also did have to have Pitocin, which we'll learn later. And so learning about what Pitocin was and what it did, and learning how to kind of cope with that, with the harder contractions, the childbirth education course really did make me feel a little bit better about having to be induced.
Well, let's get into your birth story. So how was the end of your pregnancy and your birth?
Yeah, so pregnancy was pretty chill. I didn't have any crazy sickness or anything. We did, when we had our 20-week anatomy scan, found out that the baby had a 2-vessel cord, or a single umbilical artery. And so basically his umbilical cord, you're supposed to have 3 vessels, and his only had 2. So our midwife said, hey, we want to get this checked out. So I was sent off to a high-risk clinic, and we did have to have some additional genetic testing and ultrasounds and things like that. Thankfully, everything did come back clear. We did just have more ultrasounds in the later part of my pregnancy to make sure he was growing correctly, because sometimes that can make babies smaller, and it can make them come early, which it kind of did in my case. I was 35 weeks and 6 days, and I went to the doctor, and my blood pressure was really high. And so we ended up having to be monitored. Stayed in labor and delivery for, I think, 4 hours, and they monitored my blood pressure. But it was fine enough for me to go home that day. But they did say, hey, you're going to have this baby before 37 weeks. And I was like, oh, gosh, okay. So I was preparing kind of for induction after that. And I ended up having a non-stress test a couple days later at 36 weeks, and the baby was fine. And then the next day, they actually did put me on bed rest after my non-stress test, and after they found out my blood pressure was so high. So I was on bed rest, and the next day I was just kind of laying at home. I fell asleep on the couch, actually, and I didn't wake up until 11:45 when I felt a pop, and I immediately knew my water was about to break. So I hurried up off the couch, and I stood up, and all of a sudden the water just gushed everywhere. It was so much water. I was not prepared for that. And I was 36 and 3 when that happened. And so I had to call my husband home from work. He worked nights. And so I called him home and I was like, hey, dude, my water just broke. We got to go to the hospital. And so he came home and we headed off to the hospital. We got there around 2 a.m. and the OB that was on call, he immediately was like, hey, we're going to give you a shot to help the baby's lungs develop. That was Wednesday. I would be 36 weeks and 4 days. So he was like, your baby's going to be born technically preterm, so we're going to give you a shot, help the baby's lungs, and I'd also like to start Pitocin to get labor going because your water has broken. And I was really nervous about Pitocin, even though I had learned about it on the childbirth education course. I was still nervous because I knew that it would make contractions harder and more intense, and I really wanted to go unmedicated. And so I kindly said, please let me not have Pitocin yet. I would really like to wait and see if my body will start having contractions on its own. I was having a few, but they really weren't anything crazy. So he did let me wait, and my midwife was coming on shift the next morning. And so I asked if I could wait until she got there. And so she got there around 9 a.m. that morning, and she also suggested Pitocin. And so then I decided, because I wasn't having really any crazy contractions by then, I decided to agree to that. And so we started Pitocin around probably 9, I think. And we kind of just waited for a little bit. I was bouncing on the birth ball and just kind of trying to do some exercises. My nurse gave me some movements to do to try and encourage baby to get in a good position, because when I started having contractions, I really felt them in my back. And so she was trying to get me to have contractions more in the front, which that never really worked. So I had back labor the entire time. But by around noon, the nurse came back in and she wanted to check me because I could tell things were kind of picking up a little bit. And I was needing more support from my husband. He was doing some counter pressure, some hip squeezes, and I was having to kind of breathe through them and not talk. So she checked me and she prepared me. She's like, hey, you're probably only going to be at a 2, and that's totally fine. But I just want you to know, don't get your hopes up. You're probably going to be a 2. It's okay. And so I was really nervous. I'm like, oh my gosh, I have to be more than a 2. These are getting more intense. I don't know what I'm going to do if I'm just at a 2. I don't know if I can do this unmedicated. And she checked me and I was at a 5. And I was so shocked, but very excited because things were definitely picking up. And so that was about noon, and she decided to have me lay in the bed because I was still having back labor, and she was trying to make sure the baby was in a good position. So I laid down on my side, and she had the peanut ball in between my legs, and she had me flip around a few times like that. She also did something called sideline release on me, and at that point, I don't really know what that was because the labor was getting really intense. As soon as I lay down in bed, everything picked up a lot, and contractions got really intense, and I ended up closing my eyes for the whole last bit of labor, so I don't really know what was going on. I just remember hanging on for dear life to the side of the bed and just trying to breathe through them. I was having to vocalize a little bit at that point, and that was really incredibly intense. And so after a few hours of that, she ended up checking me again, and I was at a 10. And so I was really shocked at that point because it was only 2 hours from when I was 5 to when I was at a 10. It was only 2 o'clock. And so she called the midwife in, and we started to push. And she wanted me to push on my back, and I was a little bit nervous about that. That wasn't the ideal position that I thought I wanted to push in, but it ended up working. And I only pushed for about 30 minutes or 20 maybe before he was out. I've never pushed so hard in my life. That was crazy. I felt like my eyeballs were going to pop out of my head, which is not what I envisioned pushing to be. I thought I was going to be, having these gentle pushes and things like that, but that didn't really work. I pushed as hard as I could. And I guess that was a good thing because my mom, she was also there at the birth. She told me that my blood pressure was going so high and the baby's heart rate was going lower with each push. And so it was good that I got him out sooner rather than later. But that was really intense. And he was born at 2:20 p.m. that day. And he weighed 5 pounds, 7 ounces, and he was 18 inches long. And so he was a little bit tiny, but again, he was 36 weeks when he was born. So, it's to be expected. And so we immediately got to do skin to skin, which is something I really wanted. The nurses were so supportive of really everything I wanted in my birth plan. And so we got to do skin to skin. We got to do delayed cord clamping. That was really exciting. And he didn't really have a lot of issues breathing or anything. They did take him after they cut the cord. They took him over and they put the CPAP on him just for a little bit, a few minutes. And he was able to come right back and he latched immediately. midwife was stitching me up at that point. I did have like she said, it was like a 1.5 degree tear, whatever that means. And so that wasn't super awful. But she also told me I had a labial tear, which I was not expecting. I hadn't heard of that as much as like a perennial tear, but I did have both of those tears. I did also have some postpartum like bleeding. I had to have a shot of Pitocin to get that stopped, and followed by a million fundal massages, which honestly were worse than contractions, I think. I definitely thought I was going to die every time they pushed on my belly. But yeah, I mean, really, overall, it was just kind of the perfect birth that I envisioned. Besides having Pitocin, that wasn't ideal, but it got him here really quick. I was not in labor very long. And so really, it was just a very beautiful birth. And it was awesome. Everything I dreamed of. He latched like a champ, and, he did really well after birth. So yeah.
That's awesome. Yeah, it sounds like you had a really supportive nurse who was able to help you through some different movements and identified that maybe there was a little bit of an issue happening that may or may not have been, but it sounded like whatever she did helped you out. Like, it certainly didn't hurt. That's awesome.
Right.
And I was really glad to hear that they were really patient with letting you wait until your midwife came on before starting Pitocin, and that it didn't seem like it was a fight for you or anything. Like, that's really awesome too.
Mm-hmm.
So how was it after the baby was born? So like pretty smooth transition into the postpartum?
Yeah, it was pretty smooth. One thing that kind of caught me off guard was how weak I felt postpartum. Pretty immediately after birth, they let me get up and take a shower, and I made the mistake of getting the water too hot, and I about passed out and fell right out of the shower because I had lost a lot of blood afterwards, which I know you guys can empathize with. But
Yes.
I was not expecting that. And so that was fun. But he did have a few, like, he was just so little. I mean, he ended up losing, I think, 7.5 ounces while we were in the hospital. So he got down to 5 pounds exactly. And he was just a really sleepy guy because he was just so little and not fully cooked yet. So we did have, I mean, it took an act of Congress to get him to eat sometimes because he just didn't want to wake up for it. And we did have to stay a few extra days. I think we didn't get discharged until Saturday, and we had him on a Wednesday after he was born, just because he was so tiny and he was having a little bit of issues staying awake for feeds. But other than that, I felt pretty good. I was expecting, because I did have those tears, to feel pretty crummy, but recovery was pretty smooth for me, thankfully. The biggest thing was that my tailbone hurt so bad after birth. I was not expecting my tailbone to hurt that bad, but my midwife was like, no, it's okay. Like, it's okay. You just pushed out a baby. Your tailbone will hurt.
There's a lot going on down there.
Yes, there was so much. But after a few days, like, it felt better. And by a couple weeks postpartum, I felt pretty good. And so, really overall great experience.
So would you have another unmedicated birth?
Honestly, I think I would. It was very, very intense, but I really enjoyed being able to feel and experience everything. So yeah, I definitely would.
I always like to ask people that who have had an unmedicated birth if they would do it again. And I feel like the majority of people say, yes, absolutely.
Mm-hmm.
Yeah. Did you have any issues with your blood pressure in the postpartum?
No, actually, I didn't, thankfully, which is so crazy because the whole pregnancy, my blood pressure she always said it was so beautiful. And then I got to 35 weeks and it just went crazy. But yeah, postpartum, it came back down to normal. So even though they did diagnose me with preeclampsia during my pregnancy, I did not have any issues with postpartum. So
awesome. That's really awesome. Do you have any advice for our listeners who may find themselves in similar situations as you? Like they find out baby has a 2-vessel cord, or they have to be induced, their water breaks before they're 37 weeks. Like, any advice for any folks that might be listening?
Yeah, I would say, especially the 2-vessel cord thing, that was really scary for me to find that out because I wasn't sure what it was. And it can be an indicator of genetic issues. And so for people, if they find out their baby has that and they have to go through genetic testing, it's very terrifying. But I want to encourage people that, it's good and it's necessary and it's important. And, extra ultrasounds at the end, like I had, you just get to see the baby more. So it's more exciting. So you just kind of have to think about it like that. And I also want to encourage people that even if, you have the 2-vessel cord or something, weird with your pregnancy, or your water breaks early, or you have high blood pressure and preeclampsia or whatever it is, you can still have the birth that you've wanted. It may not go exactly to plan. Like you might have Pitocin or, random things like that, but you can still have a beautiful, beautiful birth and you still can be supported. And so, yeah, I would just encourage people, don't give up on that birth that you want just because your pregnancy kind of has a few curveballs in it. So yeah.
Absolutely. I think that's great advice. Thank you so much for sharing your birth story and a little bit of your postpartum story here on the podcast with us. I know our listeners are going to love this story. It was really fun to hear it. So thank you so much.
Thank you.
Yeah, thank you so much for having me.
My name is Danielle, and I'm grateful for the Mama Stay Fit programming because it helped me navigate both of my pregnancies and kept me healthy and feeling strong and capable. And it taught me that I could do anything. I'm also grateful for the supportive environment and population that Gina and Roxanne built and continue to build.
So in Elysia's birth story, she shares that her baby was diagnosed with a 2-vessel cord, which means that there is only one single umbilical artery. So normally in an umbilical cord, there is 2 arteries in a single vein. It almost, when you look at it, looks like a little face with its mouth open. And when there's only 2, that means there's only 1 artery in 1 vein. So within the umbilical cord, the arteries and veins each have different jobs. The vein is what is in charge of bringing the blood from the placenta to the baby, and the arteries are in charge of bringing that deoxygenated blood in the waste away from baby back to that placenta. So when there's only 1 artery, it just can't bring as much stuff away from the baby. And this could affect the babies being sometimes smaller, so affecting how they're growing within the womb. With a single umbilical artery or 2-vessel cord, this does increase the likelihood of maybe having some other genetic abnormalities. So it is recommended to do other sort of testings, like looking at the kidneys and the heart to see if there are any other abnormalities, because usually if there's one abnormality, there's an increased risk of other things being present. So they'll normally do an ultrasound of that artery, the vein, and then as well as like the kidneys and the lungs and the hearts to see if there's anything else going on with that. There also is a likelihood of having potentially chromosomal abnormalities as well, so they'll do some more genetic testing. So the prevalence of having a single umbilical artery or 2-vessel cord is around 1% of pregnancies, so not super common, kind of rare. But within that 1% of people who have a 2-vessel cord, only about 20% of them will have other issues involved aside from that 2-vessel cord, like kidney issues or potential cardiac issues, so something wrong with their heart, kidneys, lungs, anything like that. It's only about 20% of that 1%. So it is not super common that there are other issues, but it is higher than it would be for someone who does not have a 2-vessel cord. So they do recommend that you do further testing when your baby does have a 2-vessel cord, because there is that increased risk of having those other genetic conditions that might require higher level of care after baby is born or potentially while baby is still within the womb. So just to recap, a 2-vessel cord is a cord that has only 1 artery and 1 vein rather than 2 arteries and 1 vein. This increases the likelihood that baby potentially has other sort of conditions, whether genetic conditions, heart conditions, liver conditions, maybe even like GI conditions. It only happens in about 1% of pregnancies, but within that 1%, 20% have other comorbidities such as genetic or chromosomal abnormalities. So they do recommend doing further testing on those babies to see if any of those other abnormalities are present. And they'll also watch baby closer as you get closer to your due date, especially with their weight gain, because they want to make sure that baby is growing appropriately and is not too small for their gestational age. With a single umbilical artery, this does increase the risk of potentially baby coming prematurely, so being prepared for that as well can be helpful. Thank you for listening to this episode. If you enjoyed this episode, be sure you like and subscribe to our channel so you get notified whenever we release new episodes. We release a new educational episode every Wednesday and a new birth story every Friday. If you're pregnant and you want more support from us, join our online prenatal fitness programs or our childbirth education courses, or bundle them both to get 15% off. If you're postpartum, you can join our postpartum education course and our postpartum fitness programs to help you return to fitness after birth. And if you're a professional, we have professional education courses, which includes our fitness trainer course and our birth worker course, so you can learn from our professional expertise and how to better support people in the perinatal time frame. And as a thank you for listening to this episode, you can use code STORY10 to get 10% off any of our online courses and fitness programs.